Hi, this is Bella Mehta from New York, reporting here from ACR 23 for Room Now, and I wanted to talk about an interesting abstract number 1143, talking about Still's disease and its complications. As we all know, Still's disease is an autoinflammatory disease characterized by fever, rash, and arthritis. These are the classic triads, but they can present in all different ways. Sometimes it results in complications which are life-threatening, and this abstract specifically talks about one of the most dreaded complications, which is HLH, also called as macrophage activation syndrome in autoimmune and autoinflammatory diseases. So this abstract looks at data nationwide over 5 years of all inpatients, and inpatients are the ones which would get admitted for such complications usually. So it's 5,500 patients over 5-year periods in the US who were admitted, and of these around 350 patients had HLH. Again, HLH is a complication which is sometimes difficult to treat, also known to have increased morbidity and mortality in Still's disease patients, and often I feel like in my clinical practice I see HLH be the first presentation for Still's disease. So what they found is 6.2% of the patients had HLH. Also, the patients who had HLH with Still's disease admitted were much younger, and also there was high prevalence in Hispanics, thus showing that there's a spectrum of Still's disease. I think more and more looking at the data in the past few ACRs and emerging data, saying that there is definitely an age-specific complications that we are seeing. So younger age groups often have very difficult to treat disease as well as complications, and given that it's become one whole spectrum of disease, we've renamed Still's disease as one disease which includes SJIA and adult onset Still's disease. This is important to understand, that there are these new subgroups emerging which definitely need more research in, so that we can figure out a way to sort of prevent these complications, and if they do happen, treat them appropriately at the get-go to improve outcomes. With that, please follow us more on Room Now and me on Twitter, Bella_Mehta, and thank you for listening.